stress definitely can play a role and take a toll on our bodies. And stress is typically when you feel like life's demands exceed your ability to meet those demands, whether it's perceived or whether that's necessarily the case. And sometimes it's out of our control. It may be a death in your family, or a surgery, or a situation at work, or something that you're not responsible for, and it's not anything that was in your control, and those demands are just placed on us. So cortisol is our stress hormone. So it's produced naturally by our adrenal glands, which is a tiny gland that sits on top of our kidneys. So what that does is it helps our body to cope with stressful situations. So functions of your cortisol helps balance out your blood sugar. It helps with your sleep. It helps with how your weight. Helps with your immune system. So there's lots of functions of your cortisol that play a role on every organ and every system in our body. So a little bit of stress is okay. It's actually good. But when stress is prolonged, or it's a permanent type of stress, is when it starts to take a toll on our body. So things that stress can do, it can cause increased inflammation in our body, which what happens when your inflammation is increased, then it can increase your blood sugar, increase your insulin, cause insulin resistance. That can decrease our immune system. So lots of things from stress that are not beneficial. So when we have all that stress, it affects our cortisol levels. So someone can have too high of a cortisol, which what happens then is you gain weight. People are irritable. They're not sleeping well, things like that. Or if you don't have enough cortisol, that's when we talk about adrenal fatigue. Someone is just very fatigued. They're not sleeping, maybe have a decreased sex drive, just emotional imbalances or GI disturbances, just overwhelmed, and maybe just don't care anymore. So it's real important to know where our cortisol levels are. The saliva test is our gold standard for testing our cortisol, and you take 4 collections throughout the day. So we really know what your cortisol is doing over the 24-hour period. That's very helpful. Instead of just 1 point throughout the day, then we can know what it's doing for the whole day. So it typically starts highest in the morning and decreases throughout the day, so that it's pretty close to zero by the time you go to bed at night, so that you can sleep well. Your cortisol plays a real valuable role in achieving hormone balance. So when we're talking to patients about hormones, we usually talk about cortisol as well. So once we do a saliva test and have those results back, and we know what someone's cortisol level is, then we have several supplements that we can use. Whether someone's cortisol is too high, then we have things that can lower that. Or whether they don't have enough cortisol, then we have some supplements that can help raise that. And patients typically have much better energy levels, can adjust to stress much easier, and they sleep better and just overall have a better sense of well-being.